You're listening to Oral Surgery Insights. I'm Dr. Russ Lieblick, and Dr. Brandon Rehrer is with me again. Brandon, after patients understand why wisdom teeth can be problematic, the very next question is almost always when, or even if, they actually need to be removed. It's certainly not a blanket recommendation for every person.
That's absolutely right, Russ. The decision is very individualized and requires a comprehensive assessment. We evaluate the patient's oral health, their age, any symptoms, and what our diagnostic imaging reveals about the position and potential future impact of those third molars.
I think some of the public confusion comes from an older philosophy, where nearly all wisdom teeth were recommended for removal. Our approach today is much more nuanced and evidence-based. And that's what we want to explore: the clinical factors and patient-specific circumstances that guide us in making those decisions.
Exactly. As a quick recap, the core issue is that our modern jaws often lack sufficient space, which frequently leads to impaction. An impacted tooth is essentially stuck, unable to erupt into a functional, cleansable position, and that's what sets the stage for most of the problems we see.
One of the clearest indicators for removal is when a patient is actively experiencing symptoms. Persistent pain or recurrent swelling are strong signals that intervention is likely necessary.
That's right. A common example is pericoronitis, an infection of the gum flap over a partially erupted wisdom tooth.
That's a spot that becomes almost impossible for a patient to keep clean. Food particles and bacteria get trapped under that flap, which is what causes the inflammation and infection. For the patient, this isn't just a minor toothache. It can make it difficult to eat on that side. It can affect sleep. It really disrupts their life until it's addressed.
Exactly, and that results in considerable discomfort, localized swelling, sometimes difficulty opening the jaw fully, and even a persistent foul taste or odor. Because the underlying tooth and gum flap are still there, these episodes can happen again and again.
In those situations, removing the wisdom tooth is typically the most definitive way to resolve the issue. Allowing such infections to recur isn't a good long-term plan for a patient's health and comfort.
Beyond active symptoms, what we find on X-rays often guides our recommendations, even when a patient feels fine. This proactive assessment is vital. A panoramic X-ray gives us a great overview.
These images show us the precise position and angle of each wisdom tooth, its proximity to critical structures like nerves and sinuses, and perhaps most importantly, any silent pathology. We can see if an impacted tooth is starting to cause damage to the adjacent healthy molar.
That damage can be subtle. We look for root resorption, where the wisdom tooth is literally causing a scoop to be taken out of the adjacent tooth's root. That second molar, which was perfectly healthy, can become structurally compromised.
And that's damage that can be very difficult, if not impossible, to repair. The second molar could eventually be lost because of it, which really highlights the preventative aspect of this conversation.
The development of a cyst is another serious finding. A cyst is like a small water balloon that can expand silently within the bone, weakening the jaw. Finding a cyst is a clear indication for surgical removal, along with the wisdom tooth.
And even without a cyst, a poorly positioned tooth can create a chronic plaque trap that makes the area impossible to clean. This puts the neighboring tooth, which is an important functional tooth, at high risk for decay or gum disease over time.
The patient's age also plays a significant role in this discussion, especially when we're considering removing wisdom teeth that aren't causing problems yet.
Absolutely. There's an optimal window, typically in the late teens or early 20s, where removal is often recommended as a preventative measure. At this stage, the tooth roots aren't fully developed and the jawbone is more pliable, which generally leads to a less complex surgery.
And the biology of healing is on their side as well. The body's regenerative capacity is at its peak in those late teenage years. The bone is more vascular, cell turnover is faster. All the biological factors are aligned for a more straightforward and rapid recovery.
Which means less downtime and a quicker return to normal activities like school or sports, and that's a big deal for our younger patients and their families. From a practical lifestyle perspective, having the procedure done during a school break often fits more seamlessly into their life schedule.
It comes down to weighing the current situation against the lifetime risk of that tooth causing problems. If a wisdom tooth is deeply impacted and unfavorably angled, the likelihood of it remaining trouble-free indefinitely is quite low. In such cases, preventative removal at an optimal age is a very sound health strategy.
However, it's crucial to emphasize that not every asymptomatic wisdom tooth requires immediate removal. This is a common misconception that can cause unnecessary anxiety.
Correct. If wisdom teeth are fully erupted, functional, and can be effectively cleaned, they may simply require monitoring. The same is true in other specific situations. For example, We might see a patient who is 45 years old. The wisdom tooth is deeply impacted, has been there quietly for decades with no signs of trouble, and is very close to the nerve.
In that scenario, the known risks associated with a more complex surgical procedure in an older adult might outweigh the very low risk of that quiet tooth suddenly causing a problem. So in that case, the proactive approach is actually careful monitoring, not automatic removal.
Exactly. The best treatment is always individualized. The consultation is a dialogue where we explain these findings and help patients weigh the pros and cons for their unique situation, so we can arrive at a management plan that aligns with their long-term health goals together.
So when removal is the indicated path, intervening in a timely manner offers clear advantages. It's a much more controlled and comfortable experience for the patient. They can prepare for it, arrange time off, and come in when they're healthy, rather than dealing with an urgent procedure when they're already in significant pain from an infection.
Absolutely. Preventing those advanced complications spares the patient considerable discomfort. A planned surgery on a healthy site is always safer and more predictable than an emergency procedure in the presence of an acute infection.
This really underscores the significant value of those routine dental examinations and panoramic x-rays, especially during the teenage and early adult years when wisdom teeth are typically developing. These regular checkups provide the critical opportunity to monitor their progress and make well-informed, proactive decisions at the most appropriate time.
So, Russ, the decision of when or if wisdom teeth should be removed truly involves looking at many factors. It's carefully guided by symptoms, clinical and radiographic evidence, the position of the teeth, and importantly, the patient's age and overall health.
That sums it up well, Brandon. There's no single rule for everyone, but rather a thorough consideration of each person's unique circumstances. A proactive approach, involving regular monitoring and timely intervention when indicated, is generally the best pathway to maintaining long-term oral health.
The primary objective is always to empower patients through clear communication and education, so they can make confident choices about their own healthcare in partnership with us.
Very well articulated. We sincerely hope this discussion has provided some valuable clarity on the factors that guide decisions about wisdom tooth removal. Thank you everyone for joining us today on Oral Surgery Insights.
We appreciate you spending your time with us and trust that this conversation has been both informative and helpful as you consider your own oral health or that of your family members.
We wish you all good health and well-being.